Hello, everyone. Good morning or good afternoon, depending on where you are. Thank you so much for joining us today for the fifth webinar of our Every Step of the Way Through 1000 Days series. Today's webinar, we will be talking about building community workforce capacity to equitably support chest breastfeeding. And this webinar is being recorded, and the recording will be available on our website, and it will also be shared with all participants and those who registered for the webinar. This blueprint was funded by the Centers for Disease Control and Prevention Division of Nutrition, Physical Activity, and Obesity, but the views expressed within the blueprint in this webinar do not necessarily represent those of CDC. And we just want to mention that this blueprint was developed with input from over 1,000 experts. And we also wanted to mention that the speakers do not have any financial interest to disclose. And so this webinar is approved for continuing education credits, and we will have more information on the continuing education credits at the end of this webinar. And so we're very excited today. We have all of our speakers are highly experienced public health and clinical professionals. And so today we will start with Emily Bernard. She will do an overview of Blueprint Recommendation 5. And then we will head down to Texas, and we will hear from Joan Enderle and Dr. Ajay Singh from the American Heart Association and Texas Tech University School of Medicine. And then we will hear from Tonya and Grace Yee from the Asian, South Asian, Pacific Islander Breastfeeding Task Force. And then we will go through continuing education information, and we will also have time for questions. And so NACCHO, the National Association of County and City Health Officials, supports the nearly 3,000 local health departments across the United States. Our mission is to improve the health of communities by strengthening and advocating for local health departments. So last August, NACCHO launched our Continuity of Care and Breastfeeding Support, a blueprint for communities. And so we celebrated our 1-year anniversary of the blueprint last month. And so this slide is really just a celebration of all of the things we've accomplished in 1 year with our blueprint. We've had over 1,100 downloads of the blueprint. We have had 4 webinars for our blueprint. We've had over 1,500 people in attendance. We presented at 10 conferences for our blueprint. Our consultants created 2 personalized toolkits. We funded 10 organizations to implement recommendations from our blueprint. And so we're just very excited about all the things we've been able to accomplish with our blueprint in the first year, and we hope to accomplish much more this upcoming year. And so, as I mentioned, we funded 10 organizations to implement at least 2 recommendations from our blueprint. And so their success stories are available on our website, breastfeedingcontinuityofcare.org. You can read about all of their successes, the recommendations they implemented. We also have the tools and resources that they created are all available on our website. And also our consultants, we had developed toolkits for recommendations 2 and recommendation 3, working with food pantries, and successful tips for referral connections are also available on our blueprint website and our resource library. And so just to recap, this is the 5th webinar of our Every Step of the Way series. And so if this is your first time attending our webinar, we had our launch webinar, we had webinars for recommendation 1, 2, and 3. And today we're talking about recommendation 5. So we are aware that we have skipped recommendation 4. We do plan on having a webinar for recommendation 4 sometime next year. And we also continuing education credits are still available for each of our webinars. You can go to our website if you haven't had a chance to view these webinars and receive continuing education credit. All of that information is available on our website. And so I'm going to turn it over to Emily Bernard, who has been our NACCHO breastfeeding consultant for over 7 years now, and we just love working with Emily, and she's going to give an overview of Blueprint Recommendation 5.
Thank you so much, Erica. Welcome, everyone. Like Erica said, good morning, good afternoon. We have no clue where you're coming from, and I am super excited to see the numbers keeping climbing now that we're a couple minutes into the hour. We're over 200 people, which is phenomenal. As Erica said, even having the blueprint downloaded over 1,000 times. This has very much been a baby of NACCHO's and multiple organizations, and it could not have been done without many of you who are actually probably on this call today. So a big thank you. If you played even the tiniest role in that, all of it mattered. But thank you also for then coming back and figuring out not just what the hard work kind of turned into, but now what that means for your community. So we're going to jump right in. And on this next slide, we're going to ask a couple questions. And if you are on the computer or you have access to your chat box, it's a great time for us to learn more a little bit about you, but it also helps me, tweak or emphasize some certain areas as well. But I'm a data girl, and so we always like to know who we are presenting for and a little bit about them so that we can also tailor future recommendations and future needs for what y'all really need. So let me hear some of your personal experiences when we think about navigating your community, because continuity of care is more than just this recommendation as these strategies. As Erica showed, we've already done some webinars and we have more to go. So I'm going to ask you a few questions, and I want you to answer by just saying yay or nay in the chat box. So have you ever heard from your client that their doctor told them very different infant feeding advice than yours? In other words, have they been told something that completely countered what you may be offered in an education class, in a one-on-one support group, or even one-on-one clinical lactation? Wow, lots of yeses coming in, frequently's, yays, too often. Thank you so much. And as you guys finish up in that, I'm going to roll into a second one as well. Have you ever heard from a client that they wished they could get care from someone that looked like them? Now, this is an important one, and we're going to talk a lot about it today. And sometimes it's an uncomfortable conversation. Now, many of you are saying yes, and many of you are saying no. And we're going to talk a little bit about why that might be, not just today, but also in future webinars. So a third area is, have you ever met a nurse or a doctor who did not know how to help a breastfeeding patient? And this can be wide ranging, how to do skin to skin safely, importance of self-attachment and latching, laid back breastfeeding, hand expression, sore nipples. I can go on and on about what this might look like, but there's definitely a lot of information out there. And we always want to know, what are your experiences with the people that you're interacting in? And the last one, have you ever wanted to increase your knowledge and skills on lactation management, but could not afford the course? Now, this might be continuing education. It might be basic education. It might be enhancing or maintaining. There's lots of ways that we look to not just grow our knowledge, but just maintain it. And sometimes there's a big cost that goes with that. So thank you for those of you that are sharing. We're getting a whole lot of yeses. And as we talked about some of the no's, we're going to talk about today. Because if you answered yes to some of these questions, you've probably experienced some type of gap in continuity of care from both the patient and the provider perspective. Because continuity of care is about how one patient experiences care over time. We want this cohesiveness, this linked in kind of feeling, but it's really an outcome of good information flow and good communication and coordination among providers. So let's go ahead and jump in and learn a little bit more then about why this happens and what this strategy actually talks about. Because research shows us that the root causes for any continuity of care breakdown is really in that communication, patient education, and accountability. Now, we discussed these root causes a lot during our work group meetings when we were making the blueprint, and these are the main themes that came up in the discussions, but there's also solutions that we have now proposed within the blueprint, recommendations and strategies, because clear back when in the blueprint development, work groups pulled out essential components components they highlighted would properly achieve ensuring families are educated and supported in the best ways possible. They highlighted many of these issues that became the core of the why to the recommendations. Some of these mirror the experiences of those of you who just said yes, but also very important questions that were asked that show us that more is needed to ensure that breastfeeding is approached as a preventative model, that we combat the lack of anticipatory guidance, education, and empowerment, that patient education starts before birth and is more than just giving handouts, that there is a lack of skilled providers and limited provider training available, which leads to conflicting messages with lack of consistent and evidence-based education, whether we're talking about providers, society, or even online, that many have a limited education on the protective laws and family-friendly rights, that there is far too much implicit bias and how much a provider's own lactation experiences influence their education and support offered, that families are targeted by aggressive infant formula marketing as well as providers, that lactation is rarely considered essential and often limited by staffing constraints and time constraints, and that family members are often not included. There's also a lack of community trust and very limited diversity among skilled lactation support. So these are the reasons that we see this continuity of care failure on the patient education component. And now we're going to talk about how this recommendation helps for that. So this next slide, for those of you who said yes for some of those questions, this recommendation is for you. On the Blueprint website, you will find a list of useful tools and resources related to this recommendation, which basically state we need to increase community capacity to provide consistent, tailored, evidence-based lactation education and support by regularly training all individuals who provide services to the family unit. Since pregnancy and lactation are biological parts of the human life course, it is essential that individuals interacting with pregnant and postpartum families, not only clinical providers, but also allied and support staff, front desk, medical assistants, interpreters, navigators, community health workers, and more, need to have the training to develop a solid base of information to support the health of parents and children. This needs to include positive outcomes of human milk feeding, basic lactation management, where to refer families when they need additional support, and their unique role in helping establish continuity of care. So again, we talked about these issues clear back when the blueprint was developed, and now we're here to present more on how we help do that. So the 5 strategies really come down to training everyone. Now, this isn't new information. The Surgeon General's call to action to support breastfeeding, an oldie but a goodie, recommends establishing and incorporating minimum requirements for lactation care competency into health professional credentialing, licensing, and certification. The blueprint recommendation adds that organizations should be providing services to pregnant and postpartum families and should incorporate a minimum set of lactation care competencies even into job requirements, provide these trainings, collaborate with others to achieve this strategy. We know there are limited lactation training opportunities tailored for outpatient staff working with postpartum families. Most lactation trainings are tailored and provided as a part of requirement for like baby-friendly hospital initiatives. They're aimed at lactation management in the immediate postpartum period. Given the recommendations to continue breastfeeding exclusively for 6 months and now 2 years and beyond, please give a big clap to the American Academy of Pediatrics for that new recommendation. It is expected that family units will utilize various health services over several years from pregnancy to toddlerhood. This isn't just something that magically happens at birth and then stops a couple weeks in. We know we have a huge drop off, for instance, in that 3 to 4 to 5 week marker. Therefore, we need to do better. Now, each individual interacting with families has different opportunities and influences to educate, encourage, and provide. The level of training that they need then also varies based on who they are and who they're serving. The respective different scopes within this spectrum and other healthcare disciplines are indispensable for integrating care and optimizing cost, as it helps everyone involved to understand that the family gets the appropriate level of care that matches their specific need at a given moment, because those needs may change across their breastfeeding journey. It is critical that the LSP, lactation support providers workforce, reflect the diverse communities they serve. However, there are several barriers to entrance into and maintenance of this profession. Many of you said yes just in trying to get educated education and the cost barriers today. We know there are limited opportunities to generate revenue to make a living without additional sources of income, particularly for the BIPOC community and other individuals, LGBTQI+, and persons with disabilities. Each community should identify and create or enhance access to opportunities, not just for training, but also mentorship to build this capacity. Because we need to find a consistency in educational content. We need families to interact with various entities, and those entities have strong influence on parents' decision and their ability, because the ability to breastfeed is not a choice. I'm going to say that again. The ability to breastfeed is not just a choice. We need to include breastfeeding education in medical schools, continuing medical education, and a wide other variety of skilled providers. Again, there's lots of people that provide these roles, and we're going to look at why that is. So I mentioned the Surgeon General's call to action being an oldie but a goodie, but this next slide is also an oldie but a goodie. Throughout our communities, the work of lactation support does not rest alone with traditional lactation support providers or healthcare providers, as the recommendation highlights. Now, this is from the United States Breastfeeding Committee and the CDC many, many years ago. For those of you who are unfamiliar with it, it is the socio-ecological model of breastfeeding. It helps us recognize how wide the impact is and who the supporters and sometimes detractors of continuity of care are that help protect, promote, and support breastfeeding. So what does this look like in your community? How do these individuals play a role in continuity of care for breastfeeding? Are they even aware that they're a part of the continuity of care network? Are they trained, and if so, on what and by who? Often programs and stakeholders within communities operate in silos without awareness or relationships with others that provide similar or complementary services in the community. Heck, they may not even know they matter, but if they do, how do they improve, or who can help them to improve? Now, we understand training and competency from the hospital standpoint. Again, baby-friendly hospital designation, 10 steps, and even have seen a wide expansion of how breastfeeding can be part of other systems. We have clinics, public health programs, peer counselors that operate on hospital floors that they don't even work for, stakeholders, collaborative relationships. But we must ask ourselves how that expands and ensure that the training is what is needed for the community, the specific person, and taught by the best suited individual or group, which is not always yourself. Because again, families interact with multiple people. That consistent messaging is important. We need to include education from the top to the bottom and all the way in between. And this is essential because pregnancy and lactation are biological parts of human life. It's essential throughout this entire spectrum that navigators and people who help families along the way contribute their part as they need to. So we're going to ask a poll question, and I believe it's right here, Erica. Yes, it is. Woohoo, I got it right. What type of lactation training have you had? Now, this is a wide word here. It might be a formal 40 hours lactation education curriculum. Have you done hands-on clinical hours in lactation management? Have you just embedded breastfeeding understanding into maybe a class you took, undergraduate degree or specialized training program? Was this on-the-job training, staff training, in-service, lunch and learns, or to fulfill job requirement training? Informal on your own. You're doing webinars and ad hoc opportunities, or have you attended breastfeeding support groups and classes and learned about breastfeeding that way? Or, of course, none of the above. So we're going to give you a minute and you can check multiple. This isn't an all or nothing to really get an idea about where you are learning about breastfeeding from. Where are you understanding the difference between what's maybe most recommended and sometimes recommended? For instance, recently there was a change in mastitis protocol from the Academy of Breastfeeding Medicine. And of course, that means new training. So I can tell you, I've done all of these across the spectrum of my career, but I've been in breastfeeding for almost 2 decades now. So let's see a little bit about where you have got your training. Erica, you want to launch some results for us? Wow, a nice split across the above. And luckily, less than 5% have said none of the above. And so I'd like to know, for those that said none of the above, if you got your education elsewhere, or if you're just still looking for that education, especially if cost is the barrier. But many of you have some type of education. And I want to point out that a low number, only 18%, said it was embedded into other areas. And 36%, however, do have hands-on clinical. And many of you have a variety of training, both in work and on your own. So that's phenomenal to know. And it's going to become important to understand how that matters within these strategies. So let's look at some of these strategies. The first one, we know these large rings of the socio-ecological model are more in depth for your community, but how do we know who should learn what and what should they be aware of? Well, the blueprint highlights a really important resource, the United States Breastfeeding Committee's core competencies. They help us understand a little bit about these strategy. So who needs then these minimum competency requirements? Well, let's hear actually from the San Diego Reach team. This was a takeout from a short video clip that they did about the wide variety of individuals who help support families in just one program. So I'm going to let Erica go ahead and start that video clip for us.
Hi, my name is Gina Parra. I'm the manager for prenatal support services at Family Health Centers of San Diego. Family Health Centers of San Diego is one of the biggest community clinics. We see about 2,000 pregnant moms every year. Family Health Centers of San Diego has a comprehensive program in which our mommies are very well taken care of, because they not only see the doctor, but they also talk to the nutritionist, to the health educator, to the social worker, and breastfeeding educator. Our mommies love our breastfeeding program. We have a curriculum divided in 4 sessions starting week 20 to educate our mommies and provide them all the tools to succeed when the time comes to breastfeed.
Now, straight from her mouth, as you heard, at just one setting, there's a wide host of individuals who need to have a minimum set of competency requirements to properly support families. For instance, she mentioned social workers. How many of you only work with a social worker when it's a negative capacity form? Either they're coming in from child welfare services or they're helping families meet other needs, right? That's that diverse area within the lactation field that always, though, matters. And we want to ensure that anybody who's interacting with these families has a core set of competencies that make sense for how they are playing in. So, what else do you think of in your organization or community? Pop into the chat box who in your strategy, in your community, this strategy applies to, rather. In other words, when you think of that socio-ecological model, when you're thinking of your community, who else needs some training? How do they play into this model? Give it some thought. Pop it into the chat box when you think about it. Now, when we start looking at examples of this minimum competency requirement on this next slide, again, we highlight that USBC document with the blueprint. What they really phrased it as was that they developed to provide health professionals with a guideline and framework to integrate evidence-based breastfeeding knowledge, skills, and attitudes, what we call KSAs, in the standard healthcare delivery practices. Now, the Breastfeeding Committee recommended that all health professionals possess core competencies identified in that document, but they also break up the competencies into what health professionals should know, should be able to do, and how to respectfully and appropriately accomplish those tasks. And I find that's really, really important, because what we're talking about is the ability to be able to ensure that we are getting information out into the specific roles about what they should know how to do. Now, many of us are familiar with the 10 steps, or again, baby-friendly hospital designation that hospitals utilize to ensure staff have knowledge, skills, and attitudes to carry out their appropriate care. But training of healthcare staff enables them to develop effective skills, give consistent messaging, and implement policy standards. Staff cannot be expected to implement a practice or educate a patient on a topic for which they have received no training. So this ensures health professionals provide those infant feeding services, and they're competent to be able to do so. Now, for healthcare providers, this might be a little confusing, right? Because they're trying to figure out how they fit in. And again, staff constraints, time constraints. Luckily, there's also a newly released Academy of Breastfeeding Medicine recommended core competencies for specialists practicing breastfeeding and lactation medicine care. They devised this to help serve only as a guideline for the care of breastfeeding mothers and infants and to interpret clinical protocols within the framework of inclusivity of all breastfeeding, chest feeding, and human milk feeding individuals, which is super important. There are other resources that you're seeing highlighted on this slide, such as the State Physical Activity and Nutrition, which stands for SPAN from Arkansas. This was done through the University of Arkansas for Medical Sciences. And what they did was they offered medical offices the breastfeeding protocols and a billing guide. It helped all offices understand their roles and responsibilities from the top down, bottom up, and everyone in between within their own microsystem. Now, they also have recorded free videos to help others learn from, which is great. Many are familiar also with the 9 Steps to Breastfeeding Friendly Clinics. It's an online toolkit that was developed jointly before the California WIC Association and the California Breastfeeding Coalition. And what you see pulled out here is step 2, because it's providing initial and ongoing competency-based education and training for all clinic staff on topics necessary to establish and maintain the infant feeding policy and protocols that support delivery of comprehensive breastfeeding education and clinical services. Now, what other competency resources are you aware of? Again, we're constantly building this library and we are constantly adding in wonderful information, and we get that information from great people like you. So how about for doulas, dentists, pharmacists? Place into the chat box if you're aware of some type of competency for someone that you know falls into that socio-ecological model or is a part of your community framework. We want to know about it so that, of course, we can help others know about it. Now, our next strategy is 5.2. And ideally, during the prenatal period, parents should receive ongoing evidence-based breastfeeding education support during routine appointments and be connected with community lactation support providers. So what we're really looking at here is increasing community access to multiple multi-level lactation support training opportunities. But this also talks about maintenance, minimum competencies, and what needs to happen to build the LSP workforce. And this is crucial because, again, breastfeeding doesn't just start at birth and then end in those first couple weeks. We have a huge issue that complicates families and providers' navigation regarding the types of individuals that provide lactation care. Because LSPs are a very wide breadth of support, and they're all needed and they're all an important part. And the Affordable Care Act, lactation services are now, and supplies are covered by some. Reimbursement remains a challenge. And in many federal qualified health centers, these services can be charged to the health insurance provider or even based on sliding fee scales to help offset and most importantly, sustain some of this training. But what the heck do all these initials mean when we start talking about lactation support trainings? And what, most importantly, does your community need? So this next slide is not all inclusive because it's not possible to do that, I think, in 1, 2, or even 3 slides, with so many helping to understand what we should know. Where do we learn across the wide spectrum of training available? Now, if you're confused about some of the initials that exist on this screen, start by reviewing the USBC's Lactation Support Professional Chart. It's a phenomenal list of all sorts of acronyms and kind of background on who these are and what they can do. It helps you identify and differentiate the different types of training. And what you see in front of you, again, is not an exhaustive list. It lists some that you might recognize and some that you may not across a wide range of support. It's a drop in the bucket. We want to increase community access to this lactation training again and develop the workforce. So consider building community capacity to design and deliver training to others in the community. Secure train the trainer certifications and individuals as lactation trainers, because to best support continuity of care, it's not just bringing a training nearby or finding what can be done online. It's understanding who makes up your community, what matters to them, who might already be doing the work, often unpaid, by the way, and whose work could use some beefing up. because we see way too many projects that aim to increase community support for breastfeeding, but completely undermine the basic need for peer support, or they have peer support and are lacking the higher levels of clinical or even medical need. So training should be thought of lifting up the entire community based on what the need is. Look to leverage resources, determine who needs what, how can everyone benefit. A great example across multiple years was the loving support training that was offered through WIC. Now, recently it's been retired, and if you're a WIC person, you know that your state WIC has the new platform, which many are excited about, and it includes a wide variety of level of training. Several years ago, the California Department of Health even published the Birth and Beyond training. Vermont turned it into an electronic platform. So it's important that we recognize, again, this is only a drop in the bucket. Tell me, who else in the chat box is missing? What other trainings do you know about? What have you been a part of, so that we can make sure we're highlighting everything? Now, there are some blueprint grantees on this next slide, and I highly encourage you to download the resource for this to understand what some of our communities have been doing to implement. And just really briefly, Florida Queens and Queen City Cocoa Beans both did this really, really well. They didn't just look at training, they looked at what training was needed. And I saw somebody pop into the chat box not too long ago, something about dads. So you'll of course love the Cocoa Beans, who incorporated daddy beans. Florida Keys did a lot of training and also increased the language availability, and it is so crucial in many areas. Now, strategy 5.3, if we talk about the minimal competencies, we then have to say, okay, well, what then do they need to be trained at, and how do they get that training? So this is really looking at integrating lactation support into existing programs, and there's a wide variety here. Now, these next couple slides, I need to thank the American Academy of Pediatrics for, who have been a core partner and stakeholder in the NACCHO work for many years. And they actually have a really cool program running, and you're going to hear more about other programs today from some of our guest speakers. So think about it. Where else do you need to integrate training into? Nursing schools, medical education, pharmacists, occupational therapy, doulas, this list goes on and on. Now, just as the EPIC program, another AAP project years ago, worked to train family physicians and train pediatricians, the AAP really took this pilot program with 10 medical residency programs to look to create action plans to build a culture of breastfeeding for medical trainings. And they really wanted to evaluate it. And this was no small feat. Everybody created action plans. And this is an example on this slide of one that you're seeing. And we want to make sure to give them a big shout out, because it's providing great information for what is desperately needed. We also know of a couple other programs that are out there. Drexel University College of Medicine, again, does an incorporation degree program for those that are students there, nursing, nutrition, health sciences. And we can't, of course, forget what CGBI, Carolina Global Breastfeeding Institute, is doing with the RISE lactation training model to specifically help increase Black lactation consultants. But they are working with historically Black colleges and universities, otherwise known as HBCUs, if you're unfamiliar with that term. And they have already started 2 great programs in conjunction with Johnson C. Smith University in Charlotte, North Carolina, and Ag and Technical University in Greensboro. This is a phenomenal program because, again, we not only have to lift up more training and more providers, but we need to make sure that people are serving and can be served by those that look like them and have experienced their life and are able to understand their culture from that self perspective and help in the best ways possible. Now, this next slide looks at the AAP channel. Again, in their project, they really asked, should people be supported? And so, of course, we are really excited to see the results with this, because overwhelmingly residents did not know about the policies to support employees at their organizations. But most importantly, they weren't opposed. In fact, it's barely recognizable if they were, for medical residents to be allowed to take lactation breaks, because you're going to hear a lot from one of our guest speakers about that. Now, we also have training integration across other wide parts. And so this next slide reminds us that healthcare providers are only a small part of the socioecological model. There's great work that's been done in the childcare sector. Colorado has offered a phenomenal toolkit, both center-based and home-based childcare professionals. and also identified other training opportunities. I've used these programs and they're phenomenal. Now, we have a couple blueprint grantees here, the Minnesota Breastfeeding Coalition, which works with Child Care Aware, specifically raising up the Hmong Breastfeeding Coalition, which was phenomenal, and the Thames Valley Council for Community Action, which also trained community healthcare workers on this next slide. Now, I want to go into strategy 5.4 before I turn it over to our guest speakers, which of course is a very important one that I've already hit on. And this is improving access to training and mentors to create equitable paths to career advancement. We need to build up community-based leadership, especially for LSPs of color, to better serve families of color and diversify the lactation workforce. The RISE program through CGBI is a phenomenal example of what's being done. Many of you have likely heard, and if you haven't, go look it up, the recently launched Black course. There's also Indigenous training opportunities. They are out there. And we have a couple examples on this next slide of some REACH grantees who have done that. In particular, REACH Stockton has incorporated doulas and mentorship. Worcester is doing phenomenal work, not just doing focus groups, but figuring out what culturally is needed and how they need to incorporate these doulas to not just work, but be paid for their work at a livable wage, and are working with stakeholders to do that. And in Nevada, outside Las Vegas, the Southern Nevada Health District worked with the Kijiji Sisterhood throughout COVID and has made a phenomenal outcome and changes there, because they recognized that the training didn't just have to provide education, but it needed to be rooted in the community that was better needed to serve Latinx clients, Black clients, Indigenous clients, who they were directly serving. And this is crucial. Sometimes training is needed and you are not the right person to do it. Maybe it's skill or maybe it's culture. And these next blueprint grantees also did that. The Cincinnati Children's Hospital, Rose Breastfeeding Training. Rose is a great organization. If you're unfamiliar with them, go take them a look. And the Lactancia Latina of Southwest Kansas. Another great one that has actually developed training and done a lot of work in a wide rural area. Very quickly, this last strategy, 5.5, I feel is pretty self-explanatory. We need to have consistent messaging, and there's multiple ways to do that. So on this last slide for me, we have breastfeeding family-friendly communities. We have empowerment zones. There's also curriculum out there that you can use to ensure wording is consistent. For instance, I mentioned skin to skin care. You may also have heard it called kangaroo care. We get confusion when we use these different words with families. We need to ensure that the access is out there and that we can do that. And these next couple slides where Erica's just going to breeze over, because they're all available on the website. And I want you to go there. I want you to check out the recommendations and the access that is there. And without further ado, I'm going to let Erica turn it over to our first guest speaker. Questions will be answered at the end.
Yes, thank you so much, Emily, for giving that overview of recommendation 5. And so now we are going to hear from Joan Enderle from the American Heart Association in Texas, which is a CDC REACH recipient, and Dr. Ajay Singh from Texas Tech University School of Medicine.
Well, thank you for the opportunity to share how the American Heart Association is collaborating with multiple organizations and breastfeeding champions in El Paso County, Texas, to build that community workforce capacity that will equitably support chest breastfeeding. And this is through our CDC REACH grant, which is Racial and Ethnic Approaches to Community Health, which was awarded to the American Heart Association late in 2018. It's a 5-year grant award period that runs through September 29th, 2023. Next slide, please. So the American Heart Association is a nonprofit health organization, and we're not a healthcare provider who provides direct services to breastfeeding moms. While our staff is public health professionals and some of us are healthcare providers, our key to our success has been collaboration to work with organizations in the community, in the region, in the state, including the Binational Breastfeeding Coalition, the WIC, Texas Tech Health Sciences, Infant Risk Center, and many more that you'll hear about today. So on the screen, you'll see our strategic points, strategies to increase that continuity of care and community support for breastfeeding, kind of our overall strategy, including number 3, which is what we'll talk about today, increasing lactation support training opportunities with for healthcare providers, community health workers, peer support providers that work with mothers and families. Next slide, please. There you can see. Okay, so data-informed, science-driven, community-focused organization. And so we always start with looking at the data, and that's the slide you see in front of you. The live births in El Paso County in 2020 was 11,089. 4.3% of those births were from Black women, and Hispanic Latino is 82.8% of all births. You can also see in the next point that El Paso County has very high rates of infant breastfeeding at time of discharge for all ethnicities, which is really higher than the state and the national, especially you'll notice with Black births. Now, one of the things that contribute to that, of course, is that in El Paso, we do have one baby-friendly hospital, and initially at the beginning of our grant, all but 2 hospitals were participating in the Texas 10-step program, and now we have all of them participating. But as you can see, the third point there is that, like Emily mentioned, in El Paso, we also do see a significant reduction in infant breastfeeding at 3 months, and by 6 months, it's 54%. Next slide. How have you provided, or your organization provided, healthcare professional training or education for test breastfeeding? And you should see a poll here. As you can see, there's multiple choices, things like just printed material, staff trainings, maybe through at an organization, e-learning, you can pick more than one. And we also, you can pick none of the above. And I'll please vote now. And maybe what we can do is, so you've got a good response, show the results. Okay, and what we see here is a wide variety. Great to see high numbers in online courses, webinars, staff training at work sites, and even healthcare education programs. So this is great. So let's close the poll, and for the sense of time, keep moving forward for the next slide. So part of our assessment, after looking at the data, the facts, was to understand how to help create and enhance community systems and environments through focus groups with parents and key informant interviews with healthcare providers. So for the focus groups, we recruited individuals on focus groups through flyers, posters, paid Google ads, social media, and then we had them complete screening questions on a website to verify in our IRB, we were looking for biological mothers of at least one child between the ages of 6 weeks and 2 years old. Of course, living in El Paso County, at least 18 years old, either Hispanic, Latino, Spanish, or Black African American. They were provided a gift card, $50 gift card for their participation. But one of the things we want to note is that we did not require that they be breastfeeding. And of course, the purpose for that was to learn more about their thoughts about feeding babies. The results you can see include there was a very positive understanding of the benefits of breast milk, which really reinforces the high initiation rates that we were seeing. But you can see some of the things that Emily kind of mentioned earlier. Lack of training for healthcare professionals, that moms felt a need for better breastfeeding education, and inconsistent messaging across providers, kind of differences. Moms were getting different messages from different providers. And that there was a need for more opportunities for breastfeeding education, including information about WIC for both physicians and clinic staff, in addition to the community, and increased breastfeeding supports. So this information helped help us frame our work. So let's go to the next slide. So today in our time, we're going to focus most of our time on building community workforce capacity in 3 programs and partner activities. The first is Texas Tech's Pediatric Resident Program with breastfeeding hands-on training, which, as we talked about earlier, the American Academy of Pediatrics has curriculum, and really focused on cultural appropriateness. As you can see in El Paso, it is primarily Hispanic, Latino, and so we're looking at cultural appropriateness of the trainers, the actual training, and the training models. Then we'll also talk about the Binational Breastfeeding Coalition, Look Who's Talking, which is really focused at education for people working hands-on, lactation professionals. And then we'll be talking about the healthcare provider professional education, Mixing Milk Plus Meds, which is a collaborative with the Infant Risk Center that provides continuing medical education for physicians, mid-levels, PAs, NPs, dietitians, and pharmacists. Next slide, please. So in my career as a healthcare provider, I'm actually a dietitian, and I worked closely with physicians, medical students, and residents. And I learned early on in my career that I could influence their practice through education and hands-on learning. And so when I made a career change to the American Heart Association 16 years ago, the first grant I worked on was Go Red for Women in North Dakota. And I could learn that I could easily extend that reach through work with physician associations, medical schools, nursing associations, and other allied health, in providing education there, primarily in both nutrition and breastfeeding and heart health. So currently, as my role as the senior manager, my first step was to reach out and form relationships. And this is where I had the opportunity through connections to meet Dr. Singh, who's really been a huge champion, a wonderful champion for breastfeeding in El Paso. And how that happened really was I met Dr. Singh through another contact. One of the first individuals I had reached out to was the director of the statewide Texas 10-step program for hospitals to discuss potential collaborations and focus of activities and learn more about perception of where some challenges might be or where there were opportunities for improvement in El Paso County. A few months later, this individual was attending a statewide conference and happened to meet Dr. Singh, who is a pediatrician in El Paso, and made that connection. And so lactation support is needed not just in training, but for those who are in training. And so in one of my conversations with Dr. Singh, I shared the Academy of Pediatrics and the residency curriculum training, and Dr. Singh really took it and ran with it. And it's been a great collaboration. So I'd like to turn it over at this time to Dr. Singh. You can advance to the next slide, please.
Thank you for those kind words, Joanne. And it's really amazing how we met by chance, but now we have forged a relationship, which I hope will continue in future. Before I go on, I would like to share a story about this mother. This mother I met in the NICCHO. She's a mother of a 28-weeker. And you see in the picture, this baby was at around 33 weeks corrected gestation when she was trying to breastfeed and still have an NG tube and has a little bit of oxygen going in. And at this time, we were already working on to improve rates of breastfeeding in our preterm infants. So I asked her, how is your breastfeeding going? And she gave me a look and she asked me, why can I not breastfeed my baby while I take my medications? And led me to discover that somebody had told her that she cannot breastfeed and she has to pump and dump until she takes her amoxicillin. Now, this kind of misinformation, incorrect information is not new. We've all heard it. But what I was baffled the most was that in today's world, when we have access to information on our phones so easily, it should not have taken more than 2 minutes for that person to give this mom the right information. And we know pediatric residents are the future physicians. And we thought if we can give them right tools, right hands-on knowledge, maybe, just maybe, they will retain enough information upon graduation so that they can give the right information the next time this happens. So our team met, and from about 3 to 4 months of meeting this mom the first time, you see on the right side a resident trying on first time a hands-on manual breast pump. And it has been an amazing journey. And the product that you will see in the next few slides is a result of hard work of a hardworking team. Can you go on to the next slide, please? So before I go on, I just wanted to introduce to my team, you to my team, because I think having a team which is passionate is very, very crucial. Without that, nothing can move on, I feel. So on the left, you see Miss Nikki Srinak. She's a midwife, and she had her own experience in the NICU when she delivered her 32-weeker, and she struggled to breastfeed that preterm baby. So she had already shared her struggles with me, and I already knew that she was going to be part of it. And when I offered her the chance that, would you like to join this collaborative, and she just jumped right on it. And on the right side, you see Dr. Paulina Hernandez. Because we knew our target audience was pediatric residents, we had to involve somebody who knows their work schedule inside out. And she was a chief resident at that time, a perfect match. And incidentally, I later found out she was actually one of the most passionate people that I've met in supporting breastfeeding. In the middle, I want to introduce you Dr. Hugo Cato, who also has been a crucial part of this team. He is my colleague, neonatologist. I requested him, I begged him to be part of this team because he's a great problem solver. You need somebody who can solve your problems, who can refine it and give you the right answers. So this was the first step, forming a team. Then after we met, I've been meeting with Joanne and the team beforehand that we want to pursue this going forward. We pitched this idea to the residency program director. And to our surprise, actually, she was all on it. Said, yes, let's do this, because A, none of this kind actually existed in our residency program. And B, this will actually give the residents some hands-on training, which is direly needed. So after completing this initial consultation, we took around 3 months sifting through literature. We adapted, we adopted, and we created an online module with support from American Heart Association, where they funded training models. And actually now we actually provide the residents CME credits for completion of this course. So it took around 3 to 4 months to go from initial meeting and finally having a product that can be shown to the residents. Can we move to the next slide, please? So this thing that you see on the first here, this is the whole picture of the whole curriculum that we developed for the residents. We first did a pilot of this curriculum in January 2021. And after 4 or 5 months of refining it based on the feedback that we received from the residents, from lactation consultants, we refined it, and finally we launched it for a whole residency program in July 2021. What you see, it's a mixture of quizzes, hands-on learning experiences, lactation encounters, and presentation as well. It has, what we wanted to make sure was, we don't want to overburden the residents, because from my own personal experience and watching the residents as they grow into residency as well, I know how hard they work and how much they have to go through. So we really wanted to make it as easy as possible, but as much as efficacious as possible. So this is a what you see is they have some quizzes that they take before starting their academic career in the first year, and then they finish with a post test at the end of the third year. It has, it is based on the core competencies defined by American Academy of Pediatrics and ACGME. And it also has lactation encounters that the residents have to have a feedback session with a lactation consultant, and also get feedback from the mothers themselves who they counsel upon. The second part of this curriculum is breastfeeding workshops. Now, before I go on, I have to share here that none of this has been as it is. We have made changes because as you go along into the process, we have to adapt to the changes that are occurring. So, for example, what we have done so far is we have removed some of the requirements. For example, the lactation encounters that we thought we will have them do with a lactation consultant, we are no longer requiring them to do that. Now they can have that lactation encounter with a senior nurse. The quizzes, they can do that on their own time. They don't have to do that in a specific rotation, so to give them some independency over the course as well. Can you go to the next slide, please? Now, when we started this process, we knew that we wanted to see whether what we do actually does any benefit or not. Does it have any benefit or not? So what you see here is we developed actually a questionnaire that we sent out to all pediatric residents every 6 months, and we assess their level of confidence. So this is just a snapshot of those questionnaire. And this question, we asked them, how confident do they feel about managing common breastfeeding problems? And to my surprise, to everybody's surprise, we see a remarkable increase in level of confidence in the residents. These are the first year and second year residents. And in total, about around 80 residents have taken this survey. And it has been very encouraging to us to see this result. And can go to the next slide, please. Based on the success that we obtained through the breastfeeding curriculum, now our team has set our sight on improving on a bigger scale. We are now working on improving breastfeeding support at Texas Tech University Health Sciences Center camp employee sites, because what we know from literature is happy employees who have better breastfeeding supports can also give right advice to their patients as well. So those of you who are interested in learning more about worksite improvement, I would encourage you to go and read this link on the left side. It is a paper which talks about how many states actually provide any designation to a business for breastfeeding friendliness. And those of you who want to learn about how do you develop a curriculum, I would strongly advise you to go on to the next link on the right side, which is again by AAP, which talks about developing a curriculum for the residency program for students, for any learner in your program. And with that said, I would like to end by saying this, that nothing is easy. And believe me, for the last few years have not been easy to implement any of this, from the challenges of technology to begin with. I mean, if pandemic has taught us anything, is that technology is your friend, and we have really embraced it in this curriculum, which is all online. And again, begin somewhere with something, and that will go on a long way. At the end of the workshop, is it on the next slide? I think we missed a slide.
I think we must have lost the slide with the pictures of the workshops.
Right, so anyways, the slide that is missing was supposed to show you the second part of the curriculum, which is a breastfeeding workshop. And the workshops are basically hands-on workshop where we teach residents how to counsel a preterm mother, how do you deal with latching and pump problems, how do you actually work around business side of lactation support in your clinic. And we have guest speakers for all of them. And at the end of each workshop, I make sure to tell them, to all the residents, that they need to be an advocate for breastfeeding and not an adversary. And I don't mean to tell them that they are adversary. What I mean to tell them, sometimes our actions as providers are viewed as adversarial. For example, a baby is born, and immediately what happens is we take that baby away from the mom's chest and take him to the warmer and examine over there. Why do we need to do that if the baby is healthy and is crying and has good tone? And I remind them those little steps are seen and are a barrier to a successful breastfeeding by that mom, and we should not be doing that. That's what the slide was going to be about. But however, thank you for this opportunity to talk to you about what we are doing in our program here in Texas Tech in El Paso, and I will turn it over back to Ms. Joanne.
Thank you, Dr. Singh and the team. It's really been a fun experience, and it's been great to work with them. Like Dr. Singh said, it's a learning opportunity, but it's a great to be training them. And you probably couldn't see it very well with the resident who had the model, but part of our work was supporting all the hands-on models. And I was really pleased that we were able to get all of the models that are used in the program in Black and brown skin tones, which is really talking about having providers look like their patients, or patients to have providers that look like them. And I think one of the links that was in the chat was actually to the residency program, and you can see that the pediatric residency program really has residents that mirror the look of the community. And we are very fortunate in El Paso that we have a large number of providers, both lactation professionals, nurse, dietitians, and physicians that look like the community. So just quickly on a couple more slides, I mentioned that we work with the Binational Breastfeeding Coalition. They have, we are a member, and they have a lecture series that prior to the pandemic was an in-person one-day conference, and really gears for that lactation consult professionals, nurses, dietitians, promotoras. Initially we did support, have always supported these programs to through speaker fees. And then with COVID, the Binational Breastfeeding Coalition did not have the expertise or the resources to go virtual. And so obviously the American Heart Association does a lot of virtual webinars nationally. And so we were able to provide them technical support and training, the Zoom platform, and work with them hand in hand to give them the sustainability to be able to do the run a show script development. And one of the other great things about Zoom is that they were able to offer live Spanish interpretation. So those with Spanish as their primary language could listen to the webinar in real time and have it in their language. And as you can see, the one on the right was the first one, What You Say Baby, which was Catherine Watson Jenna, who is an expert on reading your baby, I guess, and learning cues from your baby. And earlier mentioned that we had issues or concerns both from providers and moms, and that they were getting conflicting information. And so that led to the workshop on the left, which was just recently in April, which was Breastfeeding Conversations That Make You Sweat. Really, how do you, the right way to say you are wrong. So how is a lactation professional or a promotora, how can you help correct information in an appropriate way? And then the second part was the recipe for discussing formula, because we did identify that one of the main reasons for the drop off in breastfeeding rates is the early introduction to formula. And so that session was very helpful. We had 157 health professionals just attend the last session. So next slide, please. Training for healthcare providers, as Dr. Singh mentioned in his patient story about the medication pump and dump when it wasn't necessary. So we had reached out to an expert in the field of medication during pregnancy and breastfeeding, Thomas Hale with the Infant Risk Center, and provided a free webinar plus 1 year free subscription to the Infant Risk app, so that physicians and healthcare providers in El Paso would have the opportunity to have that information at their fingertips. We are in the process of the evaluation process, which is to determine the level of confidence providers if the CME training or the CME plus app training, if there's a difference in level of confidence in providers. This training was for physicians, residents, physician assistants, pharmacists, nurses, dietitians, mid-levels, and doulas. It was also open to lactation professionals, but as you can see by the training, we were providing continuing medical training. We actually had 175 total participants across the country, but 106 of them were from El Paso. So next slide, please. Just wanted to mention a few breastfeeding support activities projects that are more community focused. The Binational Breastfeeding Resource website page, which is both in English and Spanish. It is Google, the #1 Breastfeeding El Paso, Texas site. You can see the card there. It has a QR code because one of the things that we identified was that hospitals, birthing centers, and clinics needed a way to refer patients to the community resources that was always up to date. And so by the QR code, the website can be updated daily, weekly, or as needed. And any community members or professionals can know where all the community resources are, including baby cafes and lactation consultants and WIC and just the wider range of things that are available. We've also done a WIC social media campaign, and then of course National Breastfeeding Month. 2020 we did one where El Paso mothers recorded videos and submitted them, and we put them in a standard template, and each day a different mom shared the story. And then you can see BFF is breastfeeding friendly establishments, which was done with coffee shop and coffee sleeves. And the last was the worksite. We are working with worksite mother-friendly lactation policy. And the last slide is I just want to share with you, maternal health matters, and this is why the American Heart Association has joined with other leading health organizations and are partnering with women, their healthcare teams, and communities to protect families, because losing even one mom is too many. So our real goal is to decrease maternal mortality and improve maternal health. And so you can learn more at goredforwomen.org pregnancy. And that concludes my slides, and look forward to answering questions during the Q&A period. Thank you.
Thank you so much, Joan and Dr. Singh, for that amazing presentation. And so now we are going to hear from Tonya Lang and Grace Yee from the Asian, South Asian, Pacific Islander Breastfeeding Task Force.
Thank you, Erica. So again, my name is Tonya Lang, and I'm chair of ASAP, which is the Asian, Southeast Asian, Pacific Islander Breastfeeding Task Force in Alameda County. And I'll let Grace say hi really quick.
Hi, I'm Grace Yee. I'm the board member of California Breastfeeding Coalition, and I'm also work together with Tonya on the AANHPI Lactation Collaborative of California.
Thanks. Grace and I are currently speaking from our homes in the San Francisco Bay Area, which is on the traditional unceded territory of the Ohlone people. We're here to just share some more information about our communities and to describe our AANHPI community-centered approach to uplifting our families. Next slide, please. So just a quick overview of our presentation. I'll share a little bit about ASAP and some of our past projects. We'll talk a lot about our partnerships with Breastfeed LA and Asian Health Services, and then why this grant was so needed. And then Grace will talk more about the specific activities and the timeline, some of our successes and lessons learned. Next slide. So as I mentioned earlier, I'm chair of ASAP. ASAP's mission, can you please advance? ASAP's mission is to advance breastfeeding equity for Asian, Southeast Asian, Pacific Islanders in Alameda County. We were formed in 2016 by the Alameda County Breastfeeding Coalition in collaboration with the WIC Regional Breastfeeding Liaison Program and many other different partners and organizations. I just wanted to make a quick note about terminology. So we are going to be talking a lot about AANHPI. Basically, that stands for Asian American, Native Hawaiian, and Pacific Islander. And AANHPI is really an umbrella term to describe many different cultures and distinct languages that represent like half the world. So we talk a lot about the AANHPI community, but really the community is not a monolith, right? It's a collection of heterogeneous groups that differ in so many ways, like culture and diet and language and ancestry, religion, country of origin. Most AANHPIs live in California, and California has the highest number of people who identify as Asian and the second highest number identifying as Native Hawaiian and Pacific Islander. So that's kind of why we're focusing on these communities. Next slide. So some of our past projects include our education resource guide. So we compiled a resource listing of breastfeeding educational materials that are available for free online that are translated into AANHPI languages and made these all available to the clinics and community resource programs in Alameda County. And we update this as we learn about new resources. Next. And our most recent project was the AANHPI social media toolkit. So we received funding from Friends of lactation to create a toolkit for our communities. So these are, this is a toolkit that has images that are ready for posting on Instagram. We have 6 different educational messages that are translated into 11 different AANHPI languages. And those are all available on the Alameda County website. Next. We also partnered with the Asian Pacific Islander Breastfeeding Task Force, which is part of Breastfeed LA, last year to conduct a national AANHPI lactation landscape analysis. One of the parts of that landscape analysis was a national resource mapping survey. So this is a survey that is designed for those who identify as AANHPI and or those who are primarily serving AANHPI families. And we're just trying to get a sense of what resources exist out there and how many AANHPI lactation support professionals do we have nationwide. So the survey is still open. Please go fill out the survey if you can. We would love to hear from you. Next slide. So Alameda County is located in the San Francisco Bay Area in Northern California. So as of the 2020 census, it has a population of 1.68 million. Oh, previous slide, thank you. About a third identify as AANHPI. AANHPIs account for about 30% of the births in the county, and almost half of those identified as linguistically isolated are AANHPI. So looking at breastfeeding data, when we look at the national data, it looks like AANHPIs are doing pretty well, but that's not what we see reflected in the local data that we have in California. So I don't have a whole lot of time to talk about data in Alameda County, but the short version is that Asians and Pacific Islanders have high intentions to breastfeed and fairly high initiation rates, but we also see very high rates of early supplementation and low exclusivity rates. At the same time, we also see few AANHPI lactation support providers in our county and really in the Bay Area wide, despite having such a high concentration of AANHPIs. And why is this important? I think Emily did a great job in explaining why is this important. You know, we frequently get comments from, you know, lactation support providers saying that, well, they serve everyone and anyone, right? Which is great, and that's the way it should be. But we strongly feel that in order to understand why AANHPI families breast or chest feed, you have to understand the population you're serving, right? It's kind of obvious. And who better to serve AANHPI parents than those who look like them and speak their languages and understand their cultural practices or even have the same cultural practices. The next slide. So let's talk a little bit about partnerships because we had some amazing partners in this whole project. Our first partner is Asian Health Services, which is a federally qualified health center based in Oakland, California. AHS has really strong roots in the AA and HPI communities in Alameda County and has been serving them since 1974. So they offer health and social and advocacy services for all, regardless of income, insurance status, immigration status, language, or culture, right? So, and it's not just kind of what you would consider traditional healthcare. They include mental health services, case management, nutrition, and dental care. And they offer services in English and 14 AA and HPI languages. So they are very strongly rooted in the community and offer tremendous support to our communities in Alameda County. Our other partner is Breastfeed LA. And Breastfeed LA is a local breastfeeding coalition in Los Angeles County. It's dedicated to improving the health and well-being of infants and families through education, outreach, and advocacy to promote and support breast and chest feeding in Los Angeles County and beyond. So Breastfeed LA is a 501c3 organization, and they served as our fiscal sponsor for the grant. Both of our partners understand that there may be additional barriers to building capacity within our communities and believe in providing additional support and uplifting our emerging leaders in the AA and HPI lactation and public health fields. So Alameda County is located in Northern California. LA is in Southern California. We are a north-south statewide partnership. The pandemic has, interesting enough, allowed us to form a closer relationship with our sister organizations in Southern California. And, you know, we serve similar populations, and there's no reason for us to work alone, right? So we are trying to partner together and leverage resources. Next slide, please. Wanted to talk a little bit more about Breastfeed LA's lactation education program. So they have a lactation education program that celebrates diversity, inclusion, and equity. Their program is rooted in a reproductive justice framework. Their clinical director, Hannah Hallowell, who is pictured here on the left, has been deeply involved with our project. What's great about Breastfeed LA is that they have the experience and the infrastructure in place to support our capacity building activities for AA and HPI LSPs in Alameda County. So as part of their program, they have a 45-hour lactation education specialist course, and then also a 50-hour lactation consultant education course. So between the two of those, you are able to obtain the 95+ hours of lactation education required to sit for the IBCLC exam. They also have a clinical lactation training program where they can match students with clinical sites where they can receive their clinical hours so they can sit for the IBCLC exam. In 2022, they also created the clinical lactation, the lactation lab, or they call it the lab. And that is a place for students to meet virtually twice a week to offer free lactation support to parents in their communities. So to date, the program has trained over 800 learners from across the nation, not just focused on LA County. There are lactation students nationwide. They've provided over 150 scholarships. And so far, 3 students have sat for and successfully passed the IBCLC exam, while 20 additional students are in the process of completing their eligibility requirements. So again, Breastfeed LA has been a great partner with ASAP. We've been able to leverage this partnership and rely on their expertise and their capacity to help us build capacity within Alameda County. Again, Breastfeed LA has extensive experience in training lactation students and has experience in offering scholarships. Next slide. So this is all background leading up to the fact that at the end of last year, we were awarded NACCHO funding to address recommendations 3 and 5 from the Continuity of Care and Breastfeeding Support Blueprint. So the project period was from November through just this past July. Next slide. So Emily did a great job in going over Blueprint Recommendation 5. So like that makes my job a lot easier. But these are the recommendations that we focused, or the strategies that we focused on within Recommendation 5. So really focusing on building paths to career advancement opportunities, to build up LSPs of color, and also to 5.5, where we're partnering with peer organizations to co-create resources, which Grace will talk a little bit more about. So now I'm going to hand it off to Grace to share more about her project.
Thank you. Our project activities include 4 different items. The first one I want to talk about is the prenatal toolkit. Given the influence of extended family members on infant care and decisions, our cultural relevant prenatal toolkit included a component for grandmothers, aunties, and other very important elders in the family of the expectant parents. It was translated into Chinese traditional language and also into Vietnamese. And the toolkit was also pilot tested with the Asian Health Services families. Although our work has mostly been focused on Alameda County, it's our hope that this toolkit will be translated into other ANHPI languages, and that this model can be adapted in other geographic areas with different ANHPI groups. And then for the ANHPI Lactation Education Scholarship, in order to address workforce development, which can advance cultural immunity, language access, and sensitivity towards ANHPI seeking healthcare, we offer scholarships to ANHPI identifying individuals who live and or work in Alameda County and who wish to obtain advanced educational lactation education through Breastfeed LA's lactation education program. We also conducted a survey of ANHPI lactation specialists. We also conducted an AANHPI lactation community forum during the AANHPI breastfeeding week in August, this last August. Next slide, please. Thank you. This is the toolkit that we developed. It's for healthcare providers to use during their patients' prenatal visits. And we also included a handout for extended family members. This toolkit and the handout is culturally adapted, and the toolkit is actually adapted from the existing toolkit in Alameda County. This is not an AANHPI toolkit per se, because it's tailored more for East Asian families, and it's been translated into Chinese traditional and Vietnamese, because these 2 groups are the majority of families served by Asian Health Services. This handout is about how the handout itself is about how family members can support the postpartum period during the 1-month confinement and beyond. We interview with Chinese pregnant parents. We also interview with extended family members. And we also get the healthcare providers' feedback. Because lactation education resources are very, very few that are available in AANHPI languages. Even when materials are available in AANHPI languages, they are often simply translation from the existing materials that have been designed for mainstream audiences. And so incorporating into lactation education, the cultural norms and postpartum practices into the lactation education will resonate with AANHPI families. Some of the examples are the essential role played by the extended family members in caring for the new parents and the new babies. So from February to April this year, We interview Chinese pregnant parents at Asian Health Services and their extended family members to learn more about their cultural postpartum practices and their lactation knowledge. We assess their breastfeeding educational needs and also to determine what are the effective key messages for the parents and their extended family members. The information that we gather allow us to work on culturally tailoring the toolkit. And we did that from May to June. Asian Health Services healthcare providers who serve pregnant and postpartum parents reviewed the toolkit's design and educational messages at the end of June. The toolkit content, design, and translations were finalized in July. Partnering with AHS has allowed us to speak with families about their experiences, their attitudes, and their beliefs around breastfeeding. Next slide, please. NACCHO funding has allowed us to build community capacity to support lactation by removing some of the barriers for our community members to become IBCLCs and other LSPs. In addition to challenges in completing their lactation education, many AANHPIs experience difficulties in finding placements to obtain their clinical hours for the IBCLC exam. So in January, we were able to facilitate a clinical placement for Ruta Aono. She's a student of the Lactation Education Specialist Program, and she lives in Alameda County. Her picture is on the left. In April, we chose 3 individuals to receive scholarship. They were chosen based on their past experience in supporting AANHPI families, their demonstrated commitment to serve their communities, and their level of commitment to obtaining their IBCLC certification. Picture here are Lunora Willis, she's in the middle, and Priyanka Kundu, she's on the right. Not pictured here is Janice Ho. She is a staff member at Asian Health Services. Thank you. Next slide, please.
Grace, I
Thank
think
you.
we're running short of time. Is there anything that we should be focusing on?
I just want to talk quickly about the survey that we did. So in March, go back, thank you. In March, we created an online survey about the future AANHPI lactation support professionals to learn more about their support needs and their potential barriers. Some of the identified needs and barriers included, they need to have a cultural affirming space, examples designed for ethnic specific coalitions, and the ability to share a meal together. Some of the barriers are remarks that are made by assumptions on them, and racial motivated violence in or near their home or their workplace, being the only AANHPI in the room, ignorant comments made by instructors, and spaces that are labeled AANHPI, but they are actually only Asian American focused. And so the Pacifica people are totally erased. And then poor treatment from the hospital IBCLC, they wouldn't help them. Slide 14, please. Thank you. Next slide. Thank you. Based on the survey, let's go back. Sorry, Erica. Can you go back to the slide on the community? Thank you. Oh, no, one slide back. Thank you. Based on the survey responses, we held a virtual lactation community forum during the AANHPI Breastfeeding Week for AANHPI who are interested to further their career in lactation. It was 2 hours long. It was held in the evening. And then 25 attendees joined the forum. It was open to all, not just limited to Alameda County residents. And we didn't just focus on IBCLC, we also discussed many ways to support AA and HPI families outside the scope of IBCLC. The first hour was offered by 4 panelists. 3 of them were lactation students planning on becoming IBCLC, and 1 seasoned professional with decades of experience in lactation field, but she is not an IBCLC. The second hour, we were devoted to general discussion. We tried to create a virtual safe space for them to speak openly and honestly about their experiences. Next slide, please.
Sorry, Grace, I think we're out of time.
Oh, sorry.
Oh, that's
So
okay.
Can we, how much minutes do I have? No?
I think we're out of time, actually.
Oh, sorry. Okay.
I'm so sorry. I want to make sure that Erica has enough time to go over what she needs to talk about.
Yeah,
Okay.
thank you so much, Tonya and Grace. Thank you so much for that presentation. Just quickly, I just want to go over NACCHO. We do have a funding opportunity. We're doing a second round for our blueprint implementation project, and you can find out more information. We'll put the link in the chat box for that. And then our next webinar will be on January 12th. We are going over recommendation 6. And so we will put the registration link for that in the chat box as well. And so for CERTs and CPEUs, continuing education credits, you will fill out the evaluation and the post-test. And for CDC, continuing education, we have a link with instructions, and we will put this information in the chat box so that everyone can sign up for the post-test. And I do believe we did answer all of the questions in the Q&A. We answered them in the chat box. So Harumi will put the information for the continuing education credit in the chat box so everybody has that. And I just want to thank all of our speakers so much for presenting today. And I want to thank everybody so much for joining us today for the 5th webinar of our Every Step of the Way Through the 1000 Days. And as I mentioned, we also have all of our other webinars on our website. So if you missed any of the webinars, you can go to our website, and we'll also have all of the evaluation and continuing education information on our website as well. Thank you all so much for joining us today.
My apologies to Erica. Sorry, Erica, for taking up so much of your time.
Yeah, sorry, we can talk all day, apparently.
Is there something left, or can we leave?
No, everyone's free to go. We're just leaving up the information for the continuing education to make sure everybody has that information. Thank you all so much.
All right. Thank you so much. I appreciate it.
All right, thank you for the opportunity. Sorry for going over.
No, no worries. Thank you all so much for presenting today.
All right, take care. Have a good rest of the day.
Bye, everyone.
Bye.